Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and I am excited about today's episode because two reasons. One, I think the subject matter is really interesting and super relevant. It's explantation. Dun, dun, dun. And the second is because we have Brooklyn here. And Brooklyn is one of my oldest patients, one that has been part of our practice for many years. And as always, to have a patient come, sit here, expose themselves, share their stories, I'm always honored. It requires a fair amount of courage. Brooklyn in general is a very courageous young lady, but still, big deal to come and share your time and energy with us. So we're grateful in having you and welcome to the show.
Such an honor. Thank you for having me.
So we want to talk about explantation from A to Z. We want to talk about it, A, because it's your journey and it's relevant and it's important as it was to you. And B, because it's one of the hottest topics in plastic surgery today. Plastic surgery is like everything else. It's trend driven. There's highs and lows. Within plastic surgery trends, certain areas are more trending than others. Breasts are trendy. Why? There are times where large breasts are in and there are times where small breasts are in. And so we know that from our years of the Pamela Anderson 90s, cocaine chic, big boobs. Then we have, now the pendulum is swinging back again. And in addition to smaller breasts is this concept of being holistic and loving yourself and self-acceptance and all of that, which is wonderful. And it adds a whole new dynamics. I want to start out with the journey and let's start from when we first met, right? That was 12 years ago?
Yeah, about 12 years ago.
We think about 12 years ago. You have two beautiful children, right? I think at the time you were in your early 30s, something like that. And you'd come to me because you have had kids and you lost some volume in your breast and you came and said, hey, you know, I love the way I look, but I wouldn't mind a little bit of some volume, some fullness, some restoration of my breasts. And so we decided to do an augmentation, right? Within a year or so, you developed a capsular contracture, which for those of you who are unfamiliar is when a breast implant goes into a body like a pacemaker, prosthetic knee, a heart valve, anything that is foreign and device, your body will know, oh, that's not you, and separate it from you, make a thin shell. That shell is a capsule, scar tissue, and every human being has it. And in some people, that scar tissue is a little bit more voracious. It's a little stronger. And while it's not dangerous, it's annoying because it changes the shape of the implant and it makes it a little harder and a little higher and so on and so forth. And the treatment is to go back, take that scar tissue out, put a new implant in, and off you go. And that is what happened. And here you are on a trajectory, and roughly 11 years goes by. And during that 11 years, you change, right? You go from your early 30s to your 40s. You start hating pumpkin pie. You never realized you liked the symphony. Your favorite color goes from blue to being purple. A lot happens in 10 years. And what do you know? You change your self-image and you realize, hey, my breasts are I'm not digging it anymore. Right. I'm not enjoying them the way I enjoyed them. And I'll ask you in a minute. And so you came to me, how long ago now has it been?
It's only been like 8 months.
8 months ago.
Yeah.
And you came to me and said, hey, Dr. Rahban, I think it's time for me to remove my implants, which we refer to explantation. So let's go back and you tell me what happened for you personally from when you had them enhanced to when you decided that it was time for you to take them out.
You know, well, I have to say that you did the most amazing job. I did.
Thank you very much.
Yes, as we know.
No, it's definitely not under any pressure nor bias, but nonetheless.
No, I mean, I did my homework. I did my research, and when I came across and had the opportunity to meet with you, I knew you were my guy. And I knew I was in great hands, and you did a beautiful job with the lift and the implant the first time. And, you know, as things, anatomy changes, and even with my revision or the thing that we had to fix, I knew I was in such great camp. Not only did you take care of me at the most highest level technically and as a doctor, but even your office and your people took care of me. So when it was time to when I was, like you said, fast forward 10 years, And I was ready to make that change. Like I knew I was in really, really good hands, and I had done a lot of thinking and a lot of, I knew that you would ask me the right questions when you came in. And so I knew I needed to be prepared, and I was really, really glad that you were able to take care of me again.
Yeah, it was a pleasure. So so the first time when you came in, you had a lift with an enhancement, and so we moved 10 years down the line, and you said to me, "Listen, Dr. Rahban, I'm here, and I'm contemplating an explantation." So explantation is a hot topic for a whole number of reasons. First reason is, what is driving the explantation? So your reason for explantation was, I have changed as a person, and therefore what used to serve me doesn't. Could be hair color, could be whatnot. And I respect that. At the end of the day, my job as your clinician is to educate you and then provide you the best outcome surgically that I think is fit. That doesn't mean I just agree with you. That doesn't mean I just go along with whatever you ask me to. I have to bring light to you, the things that you need to understand before we make that decision. So the first question I always ask is why? Because sometimes patients, they say it's too big, and they assume it's an all or none phenomenon. The all or none is, I got to get it out or keep it. And it could be you could downsize. There's a lot of variabilities. But yours was very specific, and you said, I just think it's time for me to remove the implants for a number of reasons, and I don't want to have the implants anymore. You didn't at the time have, and this is why this is such a hot topic, there's this whole world of what's called BII, breast implant illness. So let's elaborate on that because it's super important. It is a unknown landscape, but it is essentially a very small subset, and I underscore small subset, but I underscore not a non-subset. I do believe that there is a group of individuals in whom this does impact them. Their body's reaction to this foreign device is one that leads them to having what I refer to as constitutional symptoms. So the fact is that you put a foreign body into a human being and all people will react, right? It doesn't matter, Susie, John, Gail, it doesn't matter. But in 95, 98% of people, that reaction is mild, it's finite, and it's done. In this small set of people, this reaction is ongoing, I believe. It's just a constant inflammation. It's just the body's just trying to figure out, what do I do with this thing? What do I do with this? And what do I do with things? It's been like 5 years, 8 years, 9 years. And that inflammatory experience drains their system, and they get things like hair loss, muscle aches, memory loss, things of that nature. That's the world of BII. The reason why it's such a challenging world is because we don't have any tests. We don't have any way of knowing. It's usually a diagnosis of exclusion, meaning for example, I'll give you an example. I'm having muscle aches. Well, you don't automatically go, it's my breast implant. I've had the implant in for 10 years. How about rheumatoid? How about my diet? How about 100 other things? And then once you realize I can't find the solution, then yes, I think an implant is obvious. We want you to be healthy. That wasn't your instance. Your instance was a more emotional, holistic, and I think you said they were just too large and too heavy for you, which makes sense because, again, 30, 40 different people. So that was very important for us to underscore, which is, why are you removing them and what symptoms do you seem to be having? And yours was essentially you've just outgrown them. So then the next question I asked you is, you have two options here. And this is very important for people to understand. I'm more than happy to remove your implant, but then we need to understand, once I've removed that implant, what's left. And by what's left, I'm not just referring to how much tissue is left, but what is it going to look like? And you and all patients need to be prepared for the menagerie of outcomes. Best case scenario is that we remove the implants and you have a decent amount of breast tissue. Like, there's stuff there to work with. Like my producer Maria that we did this procedure on, we explanted her and she had a ton of breast tissue of her own. But there are instances where I take out the breast implant. Oh shit, there's very little breast tissue. And then with that breast tissue, we have to try to reconstruct it, do a lift, do something to make it look attractive. Because while you may not like your large breasts, I very seldom have had a girl or any woman come in and be like, I don't care what they look like. Just chop them off for that matter. Yeah. No, like, you still care, you just don't care if they're that big anymore. So I said to you what I say to most patients is, you have two options. Option 1 is I remove the breast implant, take a look at how much breast tissue you have, temporarily staple your breast in a lift, sit you up and look. If I feel that there's enough breast tissue, we just keep going. If I feel there's not enough breast tissue, then I can try for you to pick the smallest implant that will get the job done without being very large. Option number 2 is I don't care what they look like. Under no circumstance I want an implant. And I always like to present that option to patients because wanting them out is one thing and then wanting them to look pretty is another. So I asked you that. I said, Brooklyn, if I'm going to take out your implant and I sit you up and I notice that there isn't much breast tissue, what do you want me to do? What did you say?
Well, actually, you gave me 4 options.
Okay, well, here you go. What are the other options?
You gave me 4 options, and the reason why I refer to this is because you're so thorough, right? The 2 that were like the main ones you definitely explained. The first one was do nothing.
Right? Sure. Because at that time your breasts
we're fine.
Beautiful.
They're gorgeous.
Right? There was nothing wrong with them.
Right.
And it was, you could leave them alone.
Yeah.
Right?
Yeah, which I love. And then you gave me the option of, taking them out, doing the lift, taking them out, doing a smaller implant. And then you gave me another option, which you let me know wasn't your favorite option, which was like a fat transfer.
Sure. And I said that, so that's a great thing you brought that up, which is we can take out the implant, do the lift, and if you don't have enough tissue and we don't want to put another implant in, I can liposuction you, create some fat, and fat transfer that in. Let me caveat that for a second, explain to you why that's not my favorite. It's not my favorite for a number of reasons. On paper, what are you talking about? That's amazing. Wait, you take out this foreign thing, this silicone rubber ball, you liposuction me, I get skinny, and then you stick that fat into my breast and it gets big? What is wrong with you? Are you crazy? That's awesome. Sign me up. But that's not what happens. Yeah. What happens is, number 1, we have to liposuction you, and then you start getting some divots and some loose skin on your back, and your arms get a little irregular because we're being very aggressive, because we need a lot of fat to make a dent. We're not putting fat in your lips. We're not putting fat in your cheeks, which requires a little bit. We're trying to volumize your breasts. We need a decent amount of fat. So all surgeons will be aggressive when they liposuction the donor sites. So you'll have some issues there. I'll inject the fat into your breast, and there's a good probability a decent chunk of it will disappear within a year, in which you'll be a little underwhelmed. So for those reasons, I'm not a huge fan of it. That is right. So there were 4 options. Good. You remember better than I do.
Yeah, because you're so thorough. I love that. And I definitely chose, to just get the implants out and do the lift. That was my intention. That's what we did. Yeah.
So we opted to remove the implants, remove some of the capsule. So that's another huge, quick, big, what do I do about this capsule? What is the capsule? It's your own tissue. It's you. It's your scar tissue. It's not bad. It's not dangerous. It's not going to kill you. In the BII world, I don't feel good. Something's not right. The current philosophy is to remove the implant and the entire capsule as one unit. We refer to that en bloc. But if your issue is not, they're just big, then I generally am not a huge fan of going in and adding more surgery, more bleeding. That capsule is tissue, albeit not much, and removing that and causing all kinds of things. So if I remove any of the capsule, it's a small amount. And in your instance, there was nothing wrong. You weren't feeling my recollection is right, we didn't take out the entire capsule, did we?
I think we did.
Did we? Did we remove it? Okay, so then we did. So that's the surgery. And then, so we decided to do that. So we're gonna take a quick break.
Okay.
We're gonna come back and we're gonna tell everybody what happened. Chances are you're here, so whatever happened was good. Because if it was bad, you wouldn't be here. But we're gonna tell everyone in specific what happened with our explantation. Let's take a quick break. We'll be right back with the second half of Plastic Surgery Uncensored. All right, welcome back to the second half of Plastic Surgery Uncensored. I know everybody's waiting to see what happens. So I go into surgery, I remove the implants, I temporarily, we call that tailor tack or staple your lift because I can't want to cut it yet. And then I sit you up like like a scarecrow. And then I look at you and I go, oh, cool, you have enough breast tissue. Enough breast tissue to do what? To have a smaller but cute breast. We needed volume. So I was very excited because I didn't really have any other options anyways. It wasn't like, oh, it looks like crap, let's put a small implant. You were adamant, and I understood that I wanted out. So we went ahead and did that. Took out the capsule, did the explant, and did the lift. And we're able to create beautiful breasts that were smaller and more conducive with the person you are today.
Yeah.
All right. So who are you today?
Dude, I am lighter, brighter, stronger, and faster. You gave me exactly what I wanted. They're honestly the breasts that I like always wished that I had. I mean, I had naturally big boobs my whole life, which that, is like, dancing and golfing and all the things that were tough to do. I've always wanted, every girl does, they kind of have, like, they want what they don't have, but they're perfect. They're absolutely perfect. I love them, and myself and my husband are very happy.
Yes, yes, that is what I love, is when a person and their loved ones are happy. So the key to that is that now you have those two components, and I keep referring to them because people are very, very stuck on the one component, which is just the explantation part, which I understand is important, but they often overlook or are not as prepared for the aesthetic part. If your breasts currently were as small as they are, but were ugly, and I use the word ugly because we're, oh, how could you say that? Yes, that's pretty, that's ugly. If your breasts were exactly the size that you liked, which is lighter, better, faster, but were ugly, I promise you wouldn't be as excited as you are today. Because we are, all of us, visual. You got up, you colored your hair, you put on a little lipstick, you take care of yourself. We like to put on a beautiful presentation of our own self. This is our vessel. We want it to look its very best. So it makes me happy that you got a win-win. The size and functionality that allows you to be free and wear what you want to wear, coupled with the beauty and the shape of a beautiful, young, sort of smaller, perky type breast. And with that comes all of the benefits, right?
Yes.
You get to dress what you want to dress, you get to activate, you want to be active, and then most importantly, when you feel beautiful, it's always the grease of every intimate relationship, right?
Absolutely.
Yeah, I'm sure your husband was a superstar, amazing guy. He loved you. Either way, it's fine, doesn't matter.
Yeah.
But when you're feeling beautiful, it's so much more attractive.
Absolutely.
What kind of advice do you think people need to understand or recommend? Your girlfriend's sitting there, she's got her implants, they've been in there, she doesn't know what to do. What are your thought process? What was the process that you think you went through that you would recommend to other people now that you're at the end of the journey?
I feel like the three biggest things if you're considering that you need to kind of like work through is, I think for me, I really had to not only think about just like the visual part, but I had to think about the process of what that looked like. And the biggest thing is like, if you're going to have surgery, like, you've got to commit. Like, I chose the most elite, best doctor ever, and he's going to do his best job. But me as a patient, I needed to do that as well. So I needed to make sure that I had the time off. I needed to make sure that I had, 6 weeks. I know you're very serious about
I am strict. Yes, I know people get upset about that, but I don't give a shit.
Yeah, no, you're not. You're like, I walked in one time, I remember after my first surgery, and I had a purse that was like maybe a little heavy, and you got after me. And I was like, oh, he's no joke. Like, he really is serious about this recovery.
Yes, you would be that way with your child who is taking a risk of some sort. Yeah. And you care about them so much, you would come down on them hard and fast because you want that not to happen again.
Yeah.
Okay.
So I think the recovery, making sure that you have the time to fully recover and do all the things that you need to prepare for before surgery, being healthy, and after surgery.
Sure.
For me, myself, I had to have 6 weeks off work. I don't sit at a desk. So I needed to be able to literally just not work. So I needed to make sure that happened. And the second thing is too, you have to be financially ready to do it. I took 6 weeks off work, and I needed to make sure that like I brought, my mom into help, and that, that my kids were entertained and there was no financial strain like during that time. Right.
So let's elaborate a little bit on the recovery part. What do we expect from you from any one of these surgeries? Explant, breast lift, breast reduction, tummy tuck, whatnot, is 2 weeks where we need you to, like you said, pretty much not be at work. I mean, breasts sometimes at a week or 10 days you can go, but stomach's definitely 2 weeks. And then from 2 weeks to 6 weeks, you can work. You just can't work at Costco. You can't work at the amusement park. You can't be at UPS, right? You can work at regular jobs. So if you work at a job that's physically strenuous, then that's a different story.
Right.
So I just want to make sure that people understand that if you're a regular job, you can go back to work at 2 weeks. But if you have a job that is very manually and physically labor intensive and you want the best outcome, then you gotta give the plants a chance to, you can't go walking on the grass you just put in 2 days ago.
Yeah.
Right.
Yeah, and I did. So it was, I'm a hairdresser, so I work with my arms and shoulders and neck and back, and so I took the time off, and I was so grateful that I could do that.
Yeah.
I made the preparation, and then the last thing that I think that you really have to do is that us as a patient, you have to think about all the logistics as the doctor. You're a literal expert at what you do, and you come in so prepared every single time that it's like our job to make sure that we show up as the best patient. And I think you have to be both physically, mentally, and spiritually ready for whatever that outcome is. And I think that you have to go through those scenarios in your head. Like, what if it didn't turn out? What if it didn't turn out and they weren't like absolutely perfect? Would I be okay? And you have to be okay. Like, you have to get to a place mentally and spiritually and physically that you're okay. And I had the mantra.
Yeah, and I think what's important that you mentioned that is, for me, explantation is a stressful surgery because I'm doing something to you that I'm not sure aesthetically will be good. Remember, my number one objective when I wake up in the morning and I come to work is to enhance people's aesthetic beauty through which I enhance their lives, right? I don't come to work to make you an ugly nose. I don't come to work to make you an ugly belly. Right? I am an esthetician. I'm an aesthetically driven surgeon. So explantation runs that risk because while I'm 100% on board for patient wishes, which is I want these things out, I still have in the back of my brain this need to make you look good. And when I'm working with something that I can't, I'm very stressed, and it makes me very, very stressed. The key for me, for patients that are explant patients, is for them to behave the way you behave, which is, hey, Dr. Rahban, I get it. I'm creating a situation that has an unknown in it. And whatever happens, I'm okay with that. And when you're able to say that and mean that, which you did, it liberates me in that you already know I'm going to do the very best I can. If you were my wife, it would have made no difference. But then I don't have to feel like I'm supposed to do some sorcery work or some magic. In other words, that's part of the reason why I'm so damn thorough is patients are unreasonable. And they want explantation, they don't want an implant, they have no breast tissue, they want a complete capsulectomy, and then they want it to look like, Halle Berry's breast. Like, it's just not gonna happen. Right. And so when you do come in as you did, very sort of like, I'm at peace with whatever it's gonna look like because I need these out, that really makes my job 1,000 times easier.
Yeah, and I appreciate it. You checked me a lot. You would ask me, and you asked me the hard questions, and I appreciate it, as you do. And I really appreciate the thoroughness that you have and the expertise that you do, because you're the elite. Like, you're the elite doctor, and I have to tell the people listening that.
I appreciate that very much. It is our responsibility as professionals, your dentist, your lawyer, your financial advisor, your accountant. It's our job to make sure that we tell you the things that you haven't asked. Because just because you didn't ask it doesn't get me off the hook. Yeah. That is the very underbelly of professionalism, which is, hey, why didn't you tell me? You didn't ask. I'm off the hook. Yeah. But not really, because just because you didn't ask doesn't mean that I shouldn't have told you that, hey, you didn't ask. So part of my thoroughness is me telling you the things that I think you need to know, even if you didn't know that you needed to know them. Right. Then you can make an informed decision. Then you can say, you know what, Dr. Rahban, thank God you told me that. Now that you mentioned that to me, no, on second thought, you know what, I'd rather do it this way. As opposed to, well, you said you want an explant. This is what you get.
Yeah.
Right? Because people don't know sometimes what's awaiting them. Right? So yeah, I think this is very helpful. I think explant is on the rise. I totally get it. I think that, there is a huge movement in that direction. I'm here to facilitate whatever is the well-being of each patient. If they want it out, they want it out. They want it in, they want it in. I just want to make sure they make good choices. And I think this episode will help clarify that a little bit and recognize that, hey, I'm going to have to be at peace as you were with whatever happens through the process. Now, the great news, they look amazing, right? There's no peace to be made here. Oh, I have to be at peace with my Ferrari. Like,
Yeah.
I think it's pretty safe to say
Yeah.
you did out like with like a bandit. You know what I mean? So that makes me very happy. Well, as always, I very much appreciate you coming on, sharing your when patients come on, it supercharges these podcasts, right? Because it's so much more lively and valuable to know through the eyes of a person. So we're grateful to have you. Well, at any rate, as always, that wraps up yet another episode of Plastic Surgery Uncensored. I'm going to end with two things. I always end with the same two things. Number one, if you like our show, you find it entertaining, you find it academic, educational, whatever, go write something nice. Go write something nice. Share your, oh, wow, it was such a great episode. Well, I really enjoyed this show, because there's a lot of people that are running around like crazy trying to make these episodes happen. And when they hear that they're being well received, it puts energy behind them to continue on. The second is share our program, our podcast with people you love and that you care about, because you never know who's going to go on to do some kind of plastic surgery. And if and when they do, and you didn't share this with them and something goes awry, you'll be like, God, I wish I had. Don't do that. You don't know. They're not going to necessarily share it with you. So go ahead and just say, guys, this is really cool. Check it out if you're ever interested in plastic surgery, because I guarantee you'll be happy you did. At any rate, as always, that wraps up yet another amazing episode of Plastic Surgery Uncensored. Until next week, I'm your host, Dr. Rady Rahban, signing off on Plastic Surgery Uncensored.